Welcome back to movementprofessional.com. So we're going to take a look at the skeleton here to help us understand how to generate rotation at the thoracic spine, especially when we're looking at an exercise like the Bretzel. So one of the common misconceptions is to think that we actually want to extend the thoracic spine to promote rotation. So there is something that would be considered thoracic extension and rotation, but in order to get that extension, we actually have to be able to decompress and open up the facet joints here. So if we look at this area between the shoulder blades, it's the thoracic spine here, we have the one joint on top of the other. Right in here would be your facet joint. So if we move back this way and push our chest forward, we're going to close all of these areas down. So that closure does a couple things. The first thing is it limits our motion because it basically brings the joint into a closed packed position. It doesn't allow it to move. And it also can be a bit of an illusion. So instead of thinking that we are actually creating specific motion here, what can happen is if we think of this rib cage and the thoracic spine back here as one unit, a lot of times everything just gets tipped back like this, and what appears to be movement from the thoracic spine is just an elevation of the thorax in the front. So everything just tips backwards like that. So what we want to make sure that we're doing is we're really using our breath to create an expansion and an opening of the joints, the rib spaces, and the thoracic facet joints in this area before we think about moving and turning. So if we think about the lungs being right here like two balloons, we need to make sure that we get a good inhale that fills the lungs front and back. And the back of the lungs you could think of would be moving this thoracic spine in this direction, backwards. And that would actually create some space between these facet joints. So when we're thinking about turning, we want to make sure that we can inhale, and we want to think about actually having our shoulder blades be able to go away from each other, right? Because if the upper back moves back this way, the shoulder blades need to be able to go away from each other. And then that allows us to rotate. We also want to make sure that when we exhale, that these ribs are being pulled down by the abs, or they're being held in place a little bit by the abs, so that when we think about rotating, the ribs don't just kick up and create that thorax orientation, which is an illusion that we're actually creating more motion through the thoracic spine here. So to summarize, we need to be able to inhale and move this thorax back this way, or the thoracic spine, the rib cage back that way, so that we create enough space. Think about blowing up a tire, and then we can move a lot better. And then anytime we exhale, we don't want to really lose that expansion that we have here, but what we want to do is think about bringing the ribs down on the front side where the abdominals attach, bracing inward, belly can go inward there. So that movement of inhalation, expanding things back that way, and exhalation, pulling the ribs this way, really allows us the most optimization of rotation. We can also think of the exhale as a way to get into our oblique muscles, which will turn us. They're basically turning muscles in the abdomen. So inhale, expand back, create space in the thoracic spine, exhale, ribs down, and also exhale, promote turn through the obliques. Hopefully that makes sense, and just understand how important this concept is if you want to get the most out of your Bretzel.